Hello, everyone. Okay. Hi, everyone. Welcome. Um, so, um, all right. So we'll give it a minute to see people coming in. And great, I can see people rolling into the webinar. Welcome again. There's going to be a little delay as usual between my broadcast and what you hear. So do not think there's anything wrong with the feed. If I pause from time to time, everything is working normally. So hello, everyone. My name is Alicia Banfield from Banfield's Professional Medical English. We are a premium OET preparation provider endorsed by OET. And I'm here today to talk about a common issue that I find coming up, or we find coming up again and again with writing, and also to generally discuss writing with you. Okay? So I am going live on multiple streams here. I'm going to be mainly monitoring the OET YouTube channel. But if anything happens again with a connection, you can pop over to Banfield's Professional Medical English on YouTube. We are also streaming live there and also on Banfield's Professional Medical English Facebook. So let's start the ball rolling by greeting everyone. And I also love to see where people are calling in from, are dialing in from. Where you're joining us from for this webinar. So hello, Ruth, Relin, Sylvia, hello, Shilpa. If I pronounce your name incorrectly, please excuse me. You might also notice me looking from side to side. That's simply because I'm working here with multiple screens and might get a little confusing. Ruth is coming in from India. Welcome, Ruth. Grace, hello, everyone. Ranjith, hello. Good morning. And we have Iman coming in from the UAE. Oh, Jojo has already started with the questions. Great thing, Jojo. Difference between patient's GP and family doctor in writing. Jojo, could you do me a favor? Could you hold on to that question and save it until the discussion part of the webinar? If you guys do have questions, and I know you will, you can type them in, but also feel free, please, to hold on to that question, and we will tackle them in that section. Okay? All right. So let's jump right in. We don't have a lot of time today. So today's presentation is going to be a little different. As you know from the promo, our discussion today is about not just OET writing as a whole, but proofreading. Okay? And proofreading is very, very important because I cannot tell you how many times letters have come across my desk. Either I'm doing the writing correction or I'm doing an audit for one of the assessment teachers, and multiple errors are being picked up that would have been picked up in proofreading. And what that means is that candidates are throwing away marks unnecessarily just because of proofreading. And when you think that the difference between a 290 and a 300 is literally 1 mark, the difference between a 340 and a 350 is 1 mark. If you lose that 1 mark because of something that you could have picked up in proofreading, unnecessary loss, unnecessary waste of time and money. So today we're going to focus in on helping you to raise your proofreading game, and kind of giving you some tips on how to look and where to look. So how it's going to be divided is I'm going to keep my first little overall presentation just down to maybe 20 minutes. And then I am going to turn the webinar open and you guys can ask me any questions you want about OET writing. I know there'll be some people who might throw in questions about other subtests. You might ask questions about listening or reading or something. I will answer those too if there is time, but I will prioritize OET writing questions. Okay? So, on that note, I'm going to ask you guys to bear with me a second while I set up screen sharing so we can get on with the presentation now. I want to, and bear with me here because I tend to mess this up. Okay, so I know I'm a horror when it comes to things like this, an absolute horror. There we go. And then I am going to switch to the presentation. There we go. And right, then I'm going to open the screen. So give me 1 second here. It's so much better when I'm doing this with the help of someone else. There we go. Share. Great. Now we've got it. Well, I thought we had it. There it is. Good. Okay. So everyone should now be able to see the presentation. Give me 1 second here to do something. Oops. And again, I messed it up. Guys, I'm so sorry about this. I'm useless. But give me a second here. There we have it. Good. All right, so let's start again. And I know there are people going, oh, this woman is so useless. Great. Good. And now we go. All right. Okay. So finally we are there. So everyone should be seeing my presentation now. Absolutely wonderful. Okay, guys. So, right. So welcome. Oh, I see more people have joined us. Abdel Rahim from Sudan. I want to try that name because it looks like it's a challenge. Vinod from India, Mayada from Sudan as well. Oh, Grace from Ghana, Elizabeth from Zambia, but we've also got Mercy from the UK, Julina from Malaysia. I'm seeing Italy here, Sylvia. Good morning, good morning, good morning. Okay. So let us start by talking about the power, the value of proofreading, but I instead actually like to call it the value the power, I should say, of proofreading. Okay. Now, how many people here, and write it in the chat. Remember, I'm mainly monitoring the OET YouTube channel. So those of you following me on YouTube, how many people make a point of including proofreading in their writing process? Just write in, I proofread my letters. I proofread my letters. I just want to get a feel of how much proofreading, how much candidates actually think about proofreading. Okay. So just jot it down. I may pause, remember, in the presentation, and that is because of the delay in the feed. So does anyone do proofreading? Or if you don't have time for proofreading, you usually don't have time for proofreading, um, let us know. Let me know, okay? So Ranjit says that he has time for proofreading. He does do that. Anyone else? Just type in yes, I do, or no, I don't, or I run out of time. Okay, only one person admits to proofreading. Okay, Mani Kandan says often. Yeah, MK says I usually don't have time. A lot of people say that. So we're going to touch on that today. So some of you said often, I'm seeing more and more of you saying that you don't have time. Okay, so it's looking more and more now like an even split. So I'm seeing yes, I do. Okay, sometimes you proofread. No, I don't. Run out of time. Yeah. Okay. So we're looking like it's an even split. So I'm going to say to the ones who do proofread, keep doing it. Okay. You're probably rescuing 1 mark here and 1 mark there. To those who run out of time, I'm going to give you some tips today on how to make time with your proofreading. And for those who say, I get to do it sometimes, but not always, I'll also give some tips to you. Okay? So before we go on, I just want you to know about a free event that we are having at promedicalenglish.com. Mabel is asking, what is proofreading? Actually, Mabel, don't worry. That's one of the questions. Okay, we'll tackle that. So we have a free event coming up. It is on the 27th of February, which is what? 1 week's time. And yes, it is absolutely free. You don't have to buy anything before, during, or after. We call it our writing camp. And it is an 80-minute live class. It's not a webinar. It's not, we're actually in the classroom. You're in the classroom with me. I'm sharing worksheets with you. You're screen sharing with me, and we have an interactive class. So you can pop over to promedicalenglish.com and you can get the link. I'm trying to remember where it is. I think it's at the top of the screen. Get the link. Register when you come across this page, free OET Writing Camp. You will know that you're there. Fill it out. Then you get the Zoom link and you click to register, and you're there with me on the day. All the information about the writing camp is there. And these are just some of the things we'll do. We'll get some case notes, identify the target reader's needs. We'll pick the right points, prioritize information. We'll try writing a letter. It is an 80-minute class. It usually goes on to 90. And then we'll write a letter, and we will do a kind of peer review, peer exchange. So it should be fun, very interactive. I'll also tell you more about this, the other resources on our website for writing camp, things like ebooks and what's not. But let's get into the power of proofreading. So, first of all, before I even get into what proofreading is, there is a common misconception that every single error you make, the examiners are going -1, -2. And that is not the case. The examiners are not penalizing you for every single error, and they're not looking at all the errors the same. They're not. Okay? Nor are they expecting perfection or some sort of literary language. I know students, nurses, healthcare professionals, nurses, doctors, therapists who are in research, they tend to have a more literary writing style. But that is not what the OET examiners are looking for. And we will look at some of the criteria they are looking at, especially the ones to do with proofreading. Okay? So, someone I know asked, what is proofreading? Mabel asked that. So, what is proofreading and why is it important in your writing subtest? Proofreading is where you go through the line by line on your finished letter and you are picking up these easy to spot mistakes. Things like spelling, grammar, punctuation, things like that. And you're using these little small points to correct so that the examiner is not distracted by many of these small errors. And so you tweak your letter as a whole. Anyone who has ever sent in a writing correction and gotten it back and seen the before and after, and we do that when we're doing writing corrections. We correct your letter, but then we show you the after letter, what your letter would look like with the corrections included. Okay? So you see that your letter doesn't have to be the model letter. It could be, improved. And oftentimes you see that just by correcting 16 spelling mistakes or something, just the whole tone of your letter goes up. So that is what proofreading is. Okay? And proofreading is important. Many people will think proofreading is only important for language, where they talk about spelling. But actually, you can end up losing multiple marks under multiple categories, multiple criteria. And the main ones that come to mind, these are not the only ones, is language, content, as well as genre and style. Now, these are the OET official, they're not the criteria, but they are the descriptions of the criteria, the marking matrix. And you see here under language, spelling, punctuation, vocabulary, grammar, sentence structure are accurate. So this is the first place where bad spelling and poor grammar will lose you marks. But look here, accuracy. Content is appropriate to the reader. No information is missing. But look down here. It also says that the content is accurately represented. And I will show you how something like misspelling can result in accuracy. So you lose a mark in content as well. Okay. And then there's genre and style. Yes, it has to, you can say, sound appropriate. It has to sound professional. Okay? And we'll look a little bit more at that. So that's how OET presents it. In our courses and for our writing correction, we put it a little bit more simply because many students might not understand the more, technical, academic, linguistic language. But it's the same thing. So under language, is your writing and language easy to understand? Does your language cause strain, confusion, and misunderstanding? Why? because of vocabulary, grammar, punctuation, and spelling. And that is 7 marks. So if your language has in multiple vocabulary, grammar, punctuation, and spelling errors, you see what you've done to your language score. Okay. Then there is content. Now remember, content has to be accurate. Again, this is 7 marks. 7. So if because of spelling or something, your sentence structure is wrong, your grammar is wrong, and you give the wrong impression, look how many marks you can now lose again. And genre, do you use professional tone? And you will know if your letter is full of all kinds of errors, it affects the tone, which means that your reader is more looking at your mistakes than they're looking at the content. So you see here, 10 different spelling errors can lose you marks under 3 different criteria. So you want to avoid that if you can. So what do you need to be able to proofread? First of all, you need to be aware. What do I mean by be aware? You have got to improve your own grammar, vocabulary, punctuation, and spelling. You have got to practice these things in your preparation so that you recognize what is right and what is wrong. If you don't recognize what is right and what is wrong, how are you going to be able to correct yourself? You can't. Okay? And then in your practice, you need to be asking yourself, what common mistakes do I make? And believe it or not, this is a critical step that many students never even think to do. They don't look at their own work and go, okay, what are the common issues that I keep doing wrong? They're so focused on the marks and maybe the teaching comments that they don't look at themselves as well. So right now I want to ask you from today, when you get your feedback, start looking at yourself as well. What things do I keep doing wrong? So let's look now at some examples. Here's an example of misspelling. And it comes then under language, but also under accuracy, which is in content. So the patient's name is John Smith, but you spell John Smythe. Those are 2 different patients, not only in the case notes, but in real life. Losec and Lasix, Accutane and Acupril. As we know, many drugs look alike, they even sound alike. So when you are copying, don't let misspellings cause you to name the wrong patient or the wrong drug. Okay? Forgetting to date your letter. This is a common oversight in letters where people are so busy or so focused on writing their letter, they forget to write the date. It's a little thing, but look what? It comes under formatting of your letter, organization and layout. Okay? So in real life, this can be a legal issue. All right? But on your letter in OET, it comes under formatting. Okay. Now let's talk about grammar. Now, grammar doesn't have to be, fancy, um, what should I say, conditional tenses and advanced stuff, but simple things. Conditional forms, but simple things like tenses. Have you used present tense instead of past tense? Have you used simple past as opposed to present perfect? And in English, and I have covered this before again and again in my webinars, tenses in English are not about grammar, are not only about grammar, I should say, not only, and sentence structure. They also give information about timeline. They tell the reader, is the action finished or is it an ongoing problem? Okay, so in some cases, and I have come across this in letters, because people use the wrong tense, or even the wrong date, or even the wrong, they use since or for. I'm left going, what? Is it over? Is this happening now? Is this happening before? And that causes confusion. This causes the examiner to do the frown. And I always go, this is a bad sign in anybody reading your letter. This means there's confusion. This frown here in your face, in their face. Okay. And then the passive form is another common mistake. People mix up the passive form with um, he has been given versus he has given. They sound alike, but they're actually two different grammar forms. And in one grammar form, the person, in the passive form, the person is receiving the action. So the patient was given versus the patient has given. The patient is the one doing the action. Okay? So again, that's an inaccuracy. That's causing confusion. So you've got to be aware of grammar. Spelling overall, as I mentioned before, too many spelling errors. One spelling error here or there, they won't mind. But if you have repeated spelling errors, no. It's distracting and it also suggests carelessness. And of course, in real life, it can cause problems. Disorganized information, organization and layout, conciseness. Can you summarize and follow a logical flow so that the, you know, examiner isn't looking all over the place for your information? Because this wastes time, both for the examiner and in real life. Okay? So you want, in your proofreading, you might find a little bit of information at the bottom and you might go, ooh, I want to put it at the top. You just draw an arrow very neatly and go, okay, I mean this little bit of information to go up here. All right. So, and the last thing is often, because most of the time we speak informally, these days with texting and what's not, we even write more often than not informally. And there's a habit to put can't, don't, e.g., or whatever in your formal writing. However, there are some rules when it comes to formal writing, some things you want to avoid. You want to avoid slang and colloquialisms. Yeah, that's like, yeah, I don't know. Or, and here's an example. Imagine writing in a formal letter, she's not there mentally. Now, this may be a fact, but if you're writing on a paper in a formal letter, you want to say, Ms. Smith was not aware of her surroundings, or Ms. Smith often gets confused. So, this is slang and colloquial terms that you don't want to use in a letter. So, you need to be aware of what is slang and what is not. Rounding up now, pretty soon. And also, you want to avoid contractions. If you've got further questions, instead, if you have further questions. I'm referring because I can't reach a final diagnosis. I am referring because I cannot reach a final diagnosis. So don't use contractions, spell out the words. Okay? So all of these things together are, these are points that you can quickly pick up in proofreading. Um, Especially things like this. You know not to do that. Yeah? Okay. So those are, I'm sure there are other things that you pick up in proofreading. Again, um, when you review this video or you're thinking about your writing, remember to ask yourself, what are your common errors? So look at your work. For example, me, there is one common error that everyone who works with me will tell you I make. When I spell information, I switch around O and R. I do it 98% of the time. I review and I catch it and I switch it back. But if I write something the first time and you see it, you're going to notice INFROMATION. It's just something I do. But by reviewing my work, I know that I tend to do that. I've tried to fix it, but I can't. So I make a point when I am proofreading to look for that error. Okay? So that's one thing you need to do. That covered the topic of awareness. So the second thing you need is time management. And I know a lot of people here have said, oh, I don't have time to manage, to proofread. But I'm telling you that actually you can find time to proofread. Starts like this. When you're writing a letter, look at what steps you take in writing a letter. Some of you might think, but I don't have steps that I take. Actually, you do. If you've written more than 3 letters, you have steps that you take. So analyze yourself. What are my steps? And then ask yourself, how much time do I take for each step? Okay? Time yourself. Like get a clock and time yourself. Why? Because now you can look at the steps, see how much time you're using, and start to chisel away a minute. Chisel away a minute. So maybe your steps look like this. Reading the case notes, of course, 5 minutes. You have to. Highlighting, once they say you can start reading, highlighting the important points. Then your next step might be organizing those points in some order. And then writing your letter. Now, I call this the planning stage, and this is the writing stage. So, how many minutes do you actually take to do each of those? And what I do is I encourage my students then add another step, proofreading. Because if you know how much time, well, not case notes, reading the case notes is a set 5 minutes, you don't have a choice. But if you know you spend X amounts of minutes highlighting and, another set of minutes organizing your points, 4 minutes or 5 minutes, or 6 minutes or 7 minutes. Say, okay, I'm going to try to cut off a minute from here, cut off a minute, maybe 2 minutes from here. If you plan your letter, of course, your writing of the letter goes much more quickly. So cut off a minute here. So if you take a minute from here, a minute from here, and a minute from here, what happens? You got 3 minutes left. So you have taken from your 40-minute writing time, you've taken a minute here, taken a minute there, taken a minute there, and now you've got 3 minutes that you can spend proofreading. I don't recommend you spend any more than 3-4 minutes. Why? Because if you have too much time, there are those of you who will try to rewrite whole paragraphs and sometimes even the whole letter. Don't do it. Just don't. Don't even think about it. Okay? Good. So practice, as you practice, include proofreading as the final step in your letter writing. And yes, it does take practice. It does. It's not going to happen overnight. But if you do not factor it in as a regular habit, it will not become a regular habit. And you want it to become a regular habit. Okay? However, the fact is, it is hard to edit yourself. Okay? And I'm going to be finishing about a minute. And then, so guys, get your questions ready. The fact is, it is hard to edit yourself. For many of you, English is actually a foreign language. So you don't even know what errors you're making. And errors are mistakes that you don't even know is a mistake. Okay? A real mistake, ooh, I know that's right. Why did I write have when I know it should be has? Okay? But an error is like a genuine, I didn't even know that that is how it should be written. So if English is a foreign language for you, you don't know your errors. So you don't know to correct them. You don't think like the examiner. So Please go back and when you review this video, look at the OET criteria again. Talk to your tutors about what the OET criteria are. Get one of our ebooks, our writing ebook. Costs $2.99, dirt cheap, and it has all the criteria there in great detail. So you understand what the examiner is looking for. And there's this thing that happens to your brain. It's called habituation. Any medics here will know what I'm talking about. What it means is when you're looking at something for a very long time, you actually stop seeing certain things. Your brain tells you that the right thing is there when it isn't. And this is why authors always need an editor. Um, it's not because they can't write, it's because they stop seeing. Okay? So, because of that, you really should get feedback and note the kinds of errors that you in particular make. And in your practice, when you're analyzing yourself, focus on your most common error, the errors that come up most often, and focus on those when you are proofreading in that 3-4 minutes of proofreading time. So the question is, how much time? Well, I said 3-4 minutes. Some people only need 2, but it depends on the kind of mistakes you make. But what you don't want to be doing is throwing away marks for avoidable mistakes, things that you know you shouldn't have written. Okay? So check your spelling, your verb agreements, your tenses, your punctuation, whatever kind of errors. I've got a B here that's being thrown away, but actually you could be throwing away a C plus if that is your band score requirement. So don't throw away a B or a C plus just because you didn't proofread and pick up errors that can give you that one, mistakes that can give you that 1 mark. Okay? So again, here, I'm done for now. Remember, we've got the free writing camp that you can register for. There's a QR code if you've got your phone and you're looking at a screen, or you can go to promedicalenglish.com and find it. And also, if you want to know more about our writing resources, like our courses and our ebooks and our writing correction services, we are an endorsed official OET premium preparation provider. And you can pop over to promedicalenglish.com and check us out. So that is it. At this point in time, I will open the door to other questions. I'm going to stop sharing now so you can see me and I can see you. There we go. All right. So now I am ready for your questions. And I remember earlier seeing some questions that maybe I can start now. So Ranjif says, please share where you need to put punctuation. Now, Ranjith, you're not alone. There are many Eastern languages that don't even use punctuation, but in English, punctuation is important because it tells us what group of information goes together, what thoughts go together, and there are lots of jokes and memes out there about when punctuation is used incorrectly, how it can change the entire meaning of a sentence. Plus, again, it helps with the professional tone. Where to put punctuation is a big question, Ranjit, because the most common punctuation you're going to need in an OET letter is actually quite limited. Commas, full stops, maybe a colon, which is those top and bottom dots. Commas are, let's start with full stops. A full stop goes at the end of a sentence when you're finished a thought. Goes at the end of a paragraph when you're finished a paragraph. Commas separate either items in a list. For example, the patient had nausea, comma, vomiting, comma, um, abdominal pain, and diarrhea. So those are all similar nouns that you are separating in a sentence. So you put a comma because you're listing them in a sentence. Commas are also used, and this is a little bit more complex, to separate what we call dependent and non-dependent clauses, and also sometimes relative clauses. Well, let's stick with dependent clauses. What that means is if a bit of information, if a phrase is only giving a bit of information extra, and you can take that information out, throw it away, and the rest of the sentence still makes sense, that is called, that clause can stand alone. I'm not going to get technical. That clause can stand alone. So you put a comma before and after that clause. But if that clause is needed to make the whole sentence make sense, okay? So this is 25-year-old Mrs. Smith who has recurrent headaches. This is 25-year-old Mrs. Smith, yeah, but what? This is 25-year-old Mrs. Smith. It's not telling you anything, but who requires help? Ah, now we've got the full sentence. So before that who, you don't need a comma. This is 25-year-old Miss Smith, comma, a lawyer in a high-end law firm, comma, who is suffering from repeated ulcers. Now, the lawyer in an exclusive law firm, if you take that out, the rest of the sentence still makes sense. Okay, this is a lawyer who has recurrent abdominal pain, and the sentence still makes sense. Commas can be quite complex to use. We do whole tutorials on commas. Don't worry about it. And then the colon, which is the dot, is often used if you are going to list items afterwards. The most common one for a letter is something like listing medications a patient is on in detail. Ms. Smith is on the following medication, colon, Ramipril, 5 milligrams, Verapamil, whatever, and you go on and you go on. Okay? Or the patient has been advised to take certain steps with her wound care, keep the wound dry, comma, change dressing every 3 days, comma, check for tenderness, comma. All right? So those are the kind of most common punctuation issues that we come across, but there are lots more. So I would advise, do a writing correction, get feedback, especially on your punctuation, and look at what the correction says. Okay. Who else? Any other questions here? Well, we've covered all the ones here. Okay. Sylvia says, I am slow when I write. Sylvia, here's what I will say to you then. Honestly, if you are slow when you write, I would strongly advise that you put some time into planning your letter. Because when you're planning your letter, you can write in note form and nobody's going to read it, so no one cares. Just put it like quickly in note form, because in note form you can probably write faster, so that when you do come to write your letter, it's already kind of organized in note form, and therefore maybe you can write a little bit more quickly. Chetan says, I have average handwriting. Does that affect my score? big fat no, Chetan. It doesn't. It doesn't. Handwriting is not an OET criterion. However, with that being said, well, you said you have average handwriting, so it shouldn't be a problem. I think in my entire 8 years of doing this, or 7.5 years of doing this, I have come across maybe one or two students whose handwriting is so bad that I recommended that they do the typing, the computer-based test. Why? Not because handwriting is a criterion. It's not. But if your handwriting is so problematic that either the examiner cannot understand your words and your sentences, or it's causing, it's making you look like you're misspelling every other word. So your A's look like E's, your R's look like T's, your V's look like U's, your A's look like O's, or whatever. And it is so problematic that your tutors tell you, what's this here? What's this spelling here? Then I would say not to ignore it, but to make a point. Again, look at yourself. Um, is my letter, do my A's look like E's and what's not? And in practice, make a point in your proofreading to make sure, okay, let me go through and make sure all my A's look like E's. Okay? What about hyphenated words or the hyphen? Hyphens are not really used that much in formal writing. Okay? So, as a matter of fact, you can honestly avoid most hyphens in formal writing, in sentences. However, a nice guideline, mujtaba is this, or mutaba is this. If you see it hyphenated in the case notes, you can hyphenate it in your letter. If it's not hyphenated, then don't. Okay. Is it required to use signposting? Now, Yana, that is a big question that would actually require a longer bit of insight, a longer bit of explanation, and I don't want to take up too much. Um, in writing paragraphing, I'll sum it up by saying that in writing paragraphing is kind of what takes the place of signposting. And you can use signposting in a sense that, for example, if you're talking about how the patient was when they came into hospital versus how they were on their second day versus how they are now, if you separate it into paragraphs, you can say, when Miss Brown was admitted on the 12th, she had blah, blah, blah. By day 3, she had blah, blah, blah. Now she requires, and that's a kind of signposting. It also tells it, and it does come under organization, because once again, the examiner or the reader can quickly find information. Like if they're thinking, okay, what's going on right now? There it is. You've got on the page in a separate paragraph, now or today. So yes, signposting in that sense can be a very powerful tool in helping you get marks in organizing your information. Okay. Please, in case presentation, which one comes first? Mercy, I have to admit, I'm not sure what you're talking about. Could you explain that a little bit more? Okay. How many paragraphs should I write? Now, is it okay if I call you Kamal? Your first name is a little bit Abdel Rahim. Oh, there, I did it. But Kamal is shorter. Kamal, there's no set number of paragraphs, but I will tell you this. You don't want to chunk all of your information into one big paragraph so that the reader has to struggle to find what happened yesterday, today, and tomorrow. You don't want that. Okay? On average, an OET letter could be 3 or 4 paragraphs, but that is on average. Letters change. Letters vary. There is no must. But on average, especially since you're looking at about 200 words, yeah, it's usually about 3, 4 paragraphs. But again, it has to do with organization. When Shani says, when we start the letter, we need to leave the line after the name. Oh, you're talking about organization. So every line for the, and I'm picturing, and my eyes are closed because I'm picturing it in my mind. So when you're putting the recipient's information, you write on every line, space, letter, space, dear sir, madam, space, patient's name, or the ray line, space, then your letter. You don't have to have a ray line, but if you don't have a ray line, you have to mention the patient's name and age, like right at the beginning of that first sentence. You cannot bury it lower down in the letter. Post-operative is hyphenated or no? Hyphenated. Next. Ma'am, can I underline? Yes. So Rasika is asking, ma'am, can I underline or highlight on the question paper? Yes. The examiners do not look at the case notes. They don't really care what you do with the case notes. You can fold the case notes into an airplane and fly it across the room at the end. At the end. Joke. They're interested in what is written on the lined part of the paper only. And yes, you can use the case notes to underline, highlight, scribble notes. Aziz gave an excellent example, a 25-year-old man. You're right. 25-year-old there is hyphenated. Everyone, I'm encouraging you to scroll back up in the conversation in the chat, and you're going to see Aziz's comment there about a 25-year-old man. You're absolutely right, Aziz. That is an example of where you would use hyphenation. In English, why? Because 25-year-old here is an adjective, a describing word that describes the noun, the man. So you do put it there. We've got 8 minutes, so we're coming up. Ma'am, please share good letter structure with punctuation marks. Ranjith, doing it here would be a little bit hard, but what I'll tell you, send us an email. Here's our email. Send us an email, and you can see sample letters. After the patient's name, after the ray and patient's name, I am allowed to write. It's jumping, right? Am I allowed to then write the date of birth underneath? I see a lot of people writing the date of birth underneath the name on the ray line. Everyone, please note, you can actually write the name, comma, and the date of birth or the age on the same line. You don't have to write it on a line. Having said that, this is a minor formatting issue. I doubt very much you would lose a lot of marks for writing them on separate lines. But just so you know, or lose any marks, but just so you know, name, comma, date of birth or age. Same line. Coming down. Okay. My question is starting my OET from scratch. Okay. There's someone in here asking about starting from scratch. If you go back in this audio, in this video, you will see a page that shows our OET preparation page that we actually developed because this is a common question. I'm starting from scratch. How do I go about preparation? Go to that page and you will see some guidance there. Let's see. If something is mentioned in nursing management in future tense, then do we have to write in past tense? Aman, that's Hmm. Do you mean, okay, patient will have appointment for wound dressing review in 2 days, or patient booked for wound review in 2 days? Both of those, believe it or not, even though it says booked, both of those are future tense. If you're talking about what will happen to the patient in the future, after you write this letter, you use future tense. Okay? Ms. Smith will be seen by. Miss Smith has an appointment in outpatient clinic in 2 weeks' time. You use those kind of future language. Okay? If the date is not stated in the case notes, what do I write? Where am I supposed to write today's date? Um, Usually, you may not have a date down by the plan, but you have a date right at the top of the letter. If you do not see, and in modern case notes, I have yet to see an OET letter without the date. If you do not see a date at all, anywhere on those case notes, write today's date. But in modern OET letter case notes, there's usually a date. Okay. If you're seeing case notes that don't have a date, they may be older ones before, because OET is always upgrading. They're always standardizing and tweaking. It might be you had an older one, but in the newer letters, they always have. Exceeding 180 to 200 words. Will it reduce my score? Chioma, excellent question. Excellent. And the answer is not automatically. I'll also add to that, don't waste time counting your words in the exams. It is a waste of time. Okay? Instead, in your practice, get a feel of what 180 to 200 words looks like in your handwriting. And then after a while, you go like, okay, this letter is going on too long, or, oh, my letter is too short. But Chioma, to answer your question directly, it's this. The examiners also do not sit down and spend time counting your words, just so everyone knows that. Examiners do not sit down and count your words. Rather, if your letter looks too short, they're going to look at why your letter is too short. Or if your letter is way over 200, it's obviously too long, they're going to ask why. The most common cause is you either left out a lot of important information, or you put in a lot of information that doesn't need to be there. So this affects your conciseness and your organization layout. And that's what you lose marks on. You do not lose marks on the word count itself. You lose marks on the reason for the word count. There's a slight difference. Okay. Um, right. Oh, lucky your question was skipped. Oh, well, okay. Lucky's paying attention. She's seeing me go through the comments. In your purpose paragraph, we should write any one of the main concern. We shouldn't add so many diagnoses. Okay. Now, Lucky, you're asking about basically what to put in the purpose statement, what to prioritize. When you go through the case notes and you come to the plan, you will see the main issues for that particular target reader. The main issues for that particular target reader. So that's the first thing that goes into your purpose statement. Okay? So if the patient is diabetic for wound care and you're writing to, say, a nurse at a wound care clinic, you want to mention to the nurse that this is a diabetic who has this wound in need of care. And then you might mention she's a chronic diabetic and this is a recurrent issue. Okay? So sometimes there's a little bit of background information you can put in your purpose statement only if it is extremely relevant to this particular scenario and this particular reader. Okay, so if it's a wound and in a diabetic, all nurses and medics here and pharmacists and therapists know that often it's a recurrent issue. Skin heals, breaks down. So you might want to mention, okay, this is wound care, and what you're saying is we really want you to pay attention to this wound because this wound is a recurring problem. So in that case, it's okay to put it in the purpose statement. Okay, so Lucky, I hope that helps you. Yes, we're promedicalenglish.com. That's where we are. Yeah. Pro Medical English, you can see Alicia. Here it is, promedicalenglish.com. Yeah. And I just typed it in the chat. Click on it, you'll find us. Yeah, you can also check out our YouTube channel, our Facebook page. What else we got? We're on Instagram. I have to ask my admin where we are. Okay. Vandy is asking the difference between the GP and the family doctor. Oh, none. Family doctor, family physician, GP, they all mean the same thing. It's just um, different countries would use a different term, but a family doctor and a GP mean the same thing. Okay. How can you know the main purpose of the letter without wasting time? Olaleri, Olalir. Oops, I'm sorry if I pronounced it incorrectly. How can you know the main purpose? You have to understand the plan because usually, sorry, the last entry as well as the link between ideas. This is how you know what the main purpose is. That last entry there, it tells you about the main issues to be tackled now. Then, who are you writing to? What is their job? So don't just write to Nurse Thomas at Cardiology Clinic. Think, what does a cardiology nurse cover? What is she interested in? What is her job? And you start thinking about the relevant information for that cardiology nurse. Okay? So, main purpose honestly comes down to your reading comprehension. And make no mistake, everyone, reading comprehension is something that is indirectly being tested in the case notes. So if your reading comprehension needs help, you might end up missing out or being inaccurate in your understanding. Okay? All right, my dear. I'm going to answer one more letter because we're over time. These webinars were the plan was that these webinars would be shorter, but mine always go close to the hour mark. If you're writing a letter to a psychiatrist, do we need to include medical history, recent infection, and medication? Recent infection? I doubt it. Medical history, if it is related to the psychiatrist. So it could be a medical history where they were on some medication that caused depression. That's psychiatric. Or they were on some medication that caused mania or social withdrawal. You might want to mention that. Okay. Medication for a psychiatrist. Now, I just want to raise everyone's awareness. A psychiatrist, as opposed to a counselor, a psychiatrist is a prescribing professional who might put the patient on medication. And we all know medications can interact. So if you're writing to a psychiatrist, yes, you will want to mention medication the patient is on otherwise. Okay? Especially if it is, as I said, if the case notes mention that the medication was changed or something. Okay? So just be careful with that. All right. I'm going to answer, guys, one more question, definite this time, and then we're done. If the case notes, they say you're addressing your letter to a consultant on duty, Yeah, dear doctor, dear consultant on duty, dear sir or madam. If you don't have a name, yes. Bagsy. Okay. All right. Can we provide spelling? Ooh, that's a big one. That's the entire vocabulary. Um, Drop us a note, Lucky, and give us a little bit more detail. Oh, by the way, we're also on WhatsApp. If you go to our website, just click that WhatsApp widget and we